So a lot of people ask me about orbital pain and thyroid eye disease, and should you have pain? And it's a little known fact, but yes, thyroid eye disease is often associated with an orbital pain. People describe it often as a pain pressure sensation, and I always ask, if you had one finger, where would you localize it? And this is always a little confounding to patients because they say, well, it's not really anywhere else, it's like behind the eye. And often they point to their temple or they'll point to above their brow, but they're really trying to point behind their eye. And this pain is very hard to treat. In fact, I've had patients who've been addicted or on narcotics long term and not been able to treat this pain. But I've found two ways of treating this pain that I think are very, very effective. And we've just completed a study on one of them showing that it is 90% effective. The first way is a temporary solution. It allows that pain to be removed or lessened for about 3 months, and it uses Botox. And everyone is always very scared about Botox, but Botox is probably safer or as safe as aspirin, and especially in the very low doses that we use. I have to first say that this pain is very different than dry eye pain. It's not a pain that's associated typically with burning or other things that are really associated with dryness of the eye, and it's not relieved with artificial tears. This is a pain pressure sensation that's always there and very rarely gets relieved. So the first method uses Botox, and everyone thinks of Botox in the cosmetic realm, but it's also been used for migraine headaches for a very long period of time. And that's where I first gained this idea in thinking, well, if this pain pressure is similar to a migraine, it might be similar to a spasm or some of the other things that cause migraine headaches. And so we first started using this, injecting it in each temple, and found dramatic results. In fact, we just reviewed a study of my patients and found that it's about 90% effective at reducing the pain and pressure. The injection is painless with a little bit of numbing cream. It takes about 2 minutes to do, and it really is effective for about 3 months afterwards. Sometimes I'll also inject the front of the brow because many patients also are always trying to protect their eyes and frowning, and this can also be a source of headaches. The other method to really relieve orbital pain in thyroid eye disease is with a decompression. And I found that the decompression works very well, especially with the removal of fat. And I tend to remove fat on almost all of my orbital decompressions, and it dramatically reduces this pain pressure sensation. And patients will often wake up in the recovery room and say, wow, I feel pain from the surgery, but that nagging pain pressure sensation has been relieved. And we found that this can be very effective for many patients if it's indicated that we do decompression surgery, and that is the primary consideration. Overall, fat decompression is a very safe procedure. There's less than 1% chance of double vision, at least in our hands, and it can be done as an outpatient, either under monitored anesthesia or under general anesthesia, but either way, the patients go home and the procedure takes about an hour to do. I hope I've put to rest the myth that there is no pain in thyroid eye disease. There actually is, and this pain pressure sensation and this orbital pain is actually much more prominent than many people realize, and it can be treated.